So we're CROME Solutions, and we're a group of bioengineering seniors here at the University of Maryland. My name is Emery Myers, and this is my colleague Maria Sitnova. So the goal of our company, CROME Solutions, is to improve and innovate medical devices to aid medical professionals in providing exceptional care. So you've probably all seen these traditional blood pressure measuring devices at your doctor's office, the mercury device or the newer automated devices. What you probably haven't seen are the different cuff sizes that come with these. So blood pressure cuffs come in a variety of sizes because we know that different people have different arm sizes, and thus one size does not fit all. The AHA, the American Heart Association, recommends that a person's upper arm circumference be the sole deciding factor when choosing the appropriate cuff size. So each cuff has a recommended range of arm circumferences on which it can be used. However, this creates a problem because within this recommended range, which is typically about 10 centimeters, there's a big variation in a person's arm size. So if you think about it, a person who has a smaller arm size really shouldn't be wearing the same cuff as a larger arm. So what this means is not only does one cuff size not fit all, but one cuff does not fit all those people who fall into the recommended range. So this is the real problem that we're trying to address. Prior studies have shown that for each individual arm circumference, there's an optimal cuff width. So ideally, there'd be a different cuff size for each arm circumference. However, current cuffs, the problem with current cuffs is that they're a constant width, and you can see this by the rectangular shape. That means that these cuffs are really only ideal for one specific arm size, not the range of arm sizes on which they're used. This leads to inaccuracy in the measurements, which is a problem because inaccuracy can cause misdiagnoses and inappropriate treatment. When you're trying to diagnose diseases like hypertension, a few millimeters of mercury in your difference in your blood pressure can make a big difference. So if you have inaccurate cuffs, that means that patients who have hypertension may not be treated, while other patients may be taking medication that they don't need. So hypertension is the primary contributing factor to heart disease, which the World Health Organization lists as the #1 cause of death in both the United States and in the world. In the US alone, there are 68 million adults with hypertension. So, in other words, out of every 3 adults, 1 has hypertension. So if we were to fill this whole room, more than 6 rows would have high blood pressure. So that's a lot of people. In addition, another 59 million are considered pre-hypertensive, meaning they're at the most at risk for developing high blood pressure. So in order to accurately diagnose and treat these patients, as well as other patients in general, correctly, we need the most accurate devices. An estimated $2.2 billion will be spent solely on blood pressure measuring and monitoring devices in 2015. And we have developed a new cuff to make these devices more accurate. So this is our solution. And the tapered design allows for more accuracy by taking into account the actual circumference of the patient's arm. So the unique shape means that no longer is one cuff width being used on a range of arm sizes. So we have developed working prototypes, and we've actually been approved for human trials here on campus by the Institutional Review Board. So even though we just began trials and testing our prototype, we're excited by the results that we've seen. The graph shows data from one subject that we've tested, whose arm circumference fell at the upper end of a regular adult cuff and the lower end of a large adult cuff. We expected to see a higher blood pressure using the regular cuff, a lower blood pressure using the large cuff, and a blood pressure between these two using our CROME regular cuff. And as you can see, this is exactly what happened, indicating that not only does the width of your blood pressure cuff affect your blood pressure measurement, but using the optimal width for your arm circumference will increase the accuracy of the measurement. We'll be continuing human trials with more subjects over the next few weeks in order to validate our product.
Right. Now, one of the most exciting things about this business venture is the large size of the market. There are close to 1 million physicians in the United States alone. There's another close to 1 million staffed hospital beds where nurses take care of patients, as well as 48,000 ambulances on the roads that use blood pressure in emergency situations, and another 68 million of hypertensive adults that would be able to take blood pressure in their home with the new at-home diagnostic movement. And with another 59 million pre-hypertensive who definitely want to monitor their blood pressure at home. Now, to enter this market, we're going to manufacture the cuffs at about $5 per cuff and price them at about $20. And we'll start with the cardiologists because they're the ones that are most interested in this particular measurement, and they use it as a primary diagnostic tool for those diseases. And then we'll branch out into other medical professions with the support of the cardiology community, and as well as the at-home users, and as well as the manufacturers of other blood pressure devices, so we can sell a packaged product with multiple cuffs and multiple measurement devices. Now, we're not completely delusional about dominating this market. We realize that there are competitors. MDF Instruments and Medline are two of the biggest ones. We think that we do have the edge of the competition with the accuracy for the different arm sizes, and as well as the low cost. Now, our financial plans involves an investment of about $700,000 for the first 3 years to cover our fixed and variable costs. Part of the fixed cost is the patent, the FDA approval, and design for the manufacturing. And our variable costs include manufacturing, marketing, and professional consultation. Now, once we start manufacturing, we have a plan for the 5 years with FDA approval taking about 1.5 years, and then selling 10,000 cuffs within the first year that we're allowed to sell them. Moving on to 50,000 cuffs, still within the cardiology community, to break even and make a profit of $300,000. Then move on to the markets that I mentioned to make a profit of $3 million and expand as a dominant company in 5 years with 1 million cuffs sold and $10 million in profit. Now, this is our team. We're a group of bioengineering seniors that have been working on this for 1 year now. We all have engineering expertise and various business expertise. We've participated in various programs on campus where we have connections, as well as connections with Children's National Medical Center in DC and Johns Hopkins Medical Campus. We also have great mentors in Dr. Connolly at MTAG and Dr. Strongloth, who owns his own cardiology practice. And there you have it. We're CROME Solutions. We've created a more accurate blood pressure cuff that we believe will help hypertensive and pre-hypertensive patients better monitor their health in the United States as well as the world. Thanks.